everybody, I'm Don Counts and we're here at Lincoln Medical Center and I'm with my friend Mary Beth Seals. Mary Beth, how you doing?
I'm good, Don. Good to see you today.
Tell her about what your title is.
I am the Director of Marketing and Public Relations for the health system.
And physician recruitment.
Yeah, I do some physician recruitment too. That's right. No day's the same. That's what I tell everybody.
That's right. Well, today we're doing something that's really neat. So we're going to talk about chest pains, and we're going to talk about the way to handle people who have chest pains and what the situation, what you should do.
We are. You know, Don, this is a very important topic. We've done this type of thing several years ago. You did this before me. I think maybe even when I was still at FPU. We've run what we're going to do, we're going to call it a scenario, so to speak, of a couple of individuals who are having chest pains and what the proper protocol needs to be if you are at home or you're out at a business or out at a ball game and you go into having chest pains. You know, Don, right now, a heart attack is the #1 cause of death in Lincoln County. I don't know if you're aware of that or not, but you know, it's happening all the time. It could happen to you, it could happen to me. Heart disease knows no age, it knows no sex, no race. So we want to tell people what to do. So we're gonna do a couple of scenarios, or the folks are gonna at home are gonna see a couple of scenarios. Real interesting in that a lot of people don't know that the proper thing to do is to dial 911. That's the quickest way to get you here, to get you help, and to get you where you need to be if you are having a full-blown heart attack or any kind of heart trouble for that, you know, for that matters. So what we're going to do is we're going to show people that there is a correct way to go about this and a way that is okay, but it's not the safest and it's not the best, and it's not really what we want you to do. We want you to call 911. We want you to get here as soon as you can. Our guys, our EMS, our paramedics, and our EMTs, they are trained to know what to do to get you here, to take care of you along the way. We want to show you the time change. And if you're at home and you go into having chest pains and you call a family member or a friend, how much time you've wasted in not picking up that phone and dialing 911.
So our main goal today is to let you know you need to dial 911. You're going to see 2 reenactments. One is someone who calls a friend, and the process of how long that takes for you to come to get to where you need to be here at Lincoln Medical Center, which is, this is the area behind us where the ambulance pulls up. But if you pull up for emergencies, you'll pull around toward the front. But then the other is having the ambulance service come get you. Our emergency management system here at the Lincoln Medical Center is incredible. They do a great job. You're also going to see behind the scenes of 911 at the 911 center.
Absolutely.
And how they take the call. So this is going to be a very interesting video, and we hope you enjoy it at home.
We do, and we thank the people that have helped make this possible. We took a couple of days out to do this video for everyone. We do want to let everyone know that you may recognize the individuals in the video. They are actors and actresses. They are volunteers from the community who graciously volunteered their time to do this video, but please know that they are okay. They actually have not experienced any kind of chest pain in the recent weeks of the filming, but these are real people. These are real scenarios, real time, Don. You know, this is real time elapsed. We want to show you from start to finish what happens, the entire process. So thank you to the E911 Center for helping make this possible, Lincoln Medical Center EMS, and the hospital, and AirEvac. We're gonna show the guys helicopter too, the whole 9 yards. What's going to happen if you come in here, and how we can take care of you from start to finish.
So what you're going to see is a reenactment, 2 of them. We hope you enjoy this. Take note of the most important thing of dialing 911.
Okay. Oh, man.
Heart attacks have beginnings. Recognizing early symptoms is crucial in preventing damage to the heart.
Oh. I don't feel so good. Well, I don't know. Maybe I should get me a paper towel and wet it. I don't feel good.
Heart attacks kill women more often than men. In women, some symptoms may be the same as men, but often they are very different. Chest pain is the most common symptom. In women, it is often a feeling of squeezing, pressure, burning, or fullness in the chest or upper stomach area. Often the person will suddenly begin sweating, having nausea, or feel dizzy.
I better call Becky, let her come over here and check about me. She's good about stuff like that. Becky, you got time to come over here a few minutes? I believe you need to come over here and see about me. I don't feel good. I'm having chest pain some, and now it started hurting in my back, through my shoulders. Okay, you can come. Okay, I'll be here. I'll have the door unlocked. Just come on in. Thanks. Bye.
Carolyn,
Yeah,
where are you?
I'm back here in the den. Just come on in.
Okay.
Well, then I'm back here. I don't feel so good.
What's wrong?
My chest is hurting, between my shoulders. Oh, man. Not one thing, it's another.
What do you think it is?
Well, I don't know.
Don't you think you need to go to the doctor and have it checked out?
Well, I don't want to go, really.
Oh, I think you need to.
Yeah,
We've talked about this before.
Yeah.
You need to go.
yeah,
Okay?
yeah. I know. I should have done call the ambulance. I know.
Well, let's don't wait too late. Let's get something going, okay?
Okay. Guess I can go. Well, let me take me a Tums or two and see what that does.
Women often mistake stomach pain for indigestion.
I think we need to get on with you. Come on, let's go.
It is common for women to have pain in the back,
Okay.
neck, stomach, or
Take me
jaw.
a Tums.
This pain can occur at any time during the day or night. If during the night, it can wake you from a deep sleep.
Carolyn, don't you think we should have called 911? We'd got you there sooner.
They could have helped you.
And
I
they
know.
could-
I know they could have helped me.
You're going to have to take care of yourself. You're going to have this seen about. Make sure that everything's going all right. You've had these spells kind of before.
Yeah, I know. I should have called the ambulance. I know.
Well,
Sometimes
Need to
women
get
just
you
do
over
not
there
feel
as soon as we
good
can.
or may have an overall feeling of
it's
doom.
important. Save time. That's a critical thing.
Oh, man, I wish I'd have called the ambulance now.
Let's try to get on, get there as soon as we can, get you there.
Okay.
Are you okay?
Yeah, I'm okay. I'm okay. I need to see a doctor, hon. I'm having chest pains.
We have a chest pain.
I got it. You having chest pain?
Uh-huh.
Alrighty. Alright, we're gonna go in here and we'll get you worked up and see what's going on with you.
Okay.
Alright, can you tell us your name?
I'm Carolyn Mitchell,
Carolyn Mitchell. What's your date of birth?
12/12/44.
So what's going on with you today?
I started having chest pains about 30 minutes ago, and back on my back and down my arm.
Alright.
This is a little
Does
oxygen.
anything make it better or worse?
No, I've taken some Tums. I've got one in my mouth. Thought it might help.
Okay, have you taken any aspirin?
No, I have something to drink.
Not right now. Let us get all your lab work and stuff
Okay.
and see what's going on with you and let the doctor see you and then we'll see what we
Can I-
can get for you.
Can I have anything for pain?
Yes, ma'am. Once the doctor sees you, we'll see what we can do for you. Okay?
Okay.
This is Miss Carolyn. She come in complaining of chest pain that started about 30 minutes ago. It goes to her back. She said she took some Tums, but that didn't really help her any. She does have a history of throwing blood clots and does take cardizem and aspirin on a daily basis.
All right. I'm Dr. Giles. How you feeling?
Not too good.
Too good? You still hurting some?
Uh-huh.
Short-winded any? A
Yes.
little bit? You've been running a fever, coughing, anything like that?
Oh.
Okay. Let's take a listen to you. Besides the problem with blood clots, any other medical troubles? Blood pressure, lungs, kidneys?
I have blood pressure
High
problems.
blood pressure?
Uh-huh.
Okay. Alrighty, how long ago were these blood clots that you had?
Year and a half
A
ago.
year and a half ago. You're not taking any Coumadin?
No.
Just the aspirin?
Just the aspirin. Uh-huh.
Very good. Well, we're going to get things started. We're going to do some x-rays, some blood work, an EKG, try to sort out what's going on and get you feeling better, okay?
Okay, thank you.
You're welcome. Well, I'm looking at your EKG and it looks like you're having a heart attack.
Oh,
We're going to have to send you to a hospital that's got a heart doctor so that they can
Okay.
open up that artery and get your heart circulation back, okay?
okay.
Do you have a preference where you'd like to go? Up towards Nashville?
Yeah,
Denver?
just send me to Nashville.
Okay, all right.
St. Thomas.
Very good. In the meantime, we're going to be starting some medicines to kind of help your heart circulate better.
Okay.
And then we're going to get you on a helicopter to get you up there as soon as we can, all right?
Okay, thank
All right.
you, doctor.
Certainly.
Thank you.
This is Carter Local Medical. We have a STEMI we need area back in route for.
St. Thomas Transfer Center, this is Dr. Giles. I've got a 69-year-old woman with a acute anterior wall infarction. We need to transport for PCI. Thank you very much.
Boy, I sure don't feel so good. Kind of sweating a little bit, arms hurting a little bit of pain in my chest. Might be a good idea if I call 911.
Where's your emergency?
I think I'm having a heart attack.
Okay, so you don't have any aspirin available for you?
No, ma'am, I don't.
Please stay on the line. Attention Lincoln County EMS South Station, Flintville first responders. Respond to 175 Howell Hill Road, 175 Howell Hill Road, 60-year-old male, chest pain, timeout 1201. It's 216. Your code is going to be 10 Delta 2. AD is 175 Howell Hill Road, 60-year-old male, chest pain. Male subject does have a cardiac history. If you can, please put away any family pets, gather your medications, unlock the door, turn on the outside lights. Stay on the line until help arrives. You may possibly see first responders in their own vehicles to assist you until the ambulance arrives.
First responders.
Yes.
I'm Don with Flintville First Responders.
Okay, I've got 911 on the line.
Okay. All right. Sir, where are you hurting?
My chest and arm.
Men have classic chest pain symptoms that appear in the middle to the left side of the chest that radiates down the left arm or up into the jaw. It is a crushing pain that feels like something big is sitting on their chest.
Oh, about 5 minutes.
Other common symptoms include suddenly becoming short of breath, sweating, and clammy feeling skin.
Ambulance should be here in just a second.
Okay.
Are you allergic to anything?
No.
Take any medications?
Take a cholesterol pill.
Okay. We need to get that when the ambulance gets here, okay?
Okay.
They don't want to know that.
All right.
You have any past medical history that we need to know about?
No.
What were you doing when this started?
I was just sitting here, just been outside working a little bit and came in and sat down.
come on in. Ambulance is here.
Oh, good.
Hello. What's going on today? All right. What we got is a 68-year-old male, blood pressure 128/80. He has no allergies. He's got having chest pains. I got a little oxygen on him. What's your name, sir?
Wayne Thornton.
All right. What's going on with you today?
Was outside working. My arm started hurting, started having some chest pains and sweat. Thought I'd come in and cool off a little bit, but it didn't help.
How long has this been since you saw come about?
Oh, maybe 5-10 minutes.
Okay. All right. All right, sir. What we're going to do is we're going to have you pivot onto the stretcher here, okay?
Okay.
Your pain's hurting in your chest, right?
Yes.
Is it radiating down your arm?
Some, yes.
Okay. All right. Well, we're going to move you to the stretcher here, okay?
All right.
Get the oxygen.
Yeah, I'm gonna get the oxygen hooked to ours.
All right, sir. Just going to need you to sit and stand right here closest to the cushion.
We'll put you on our
I'll
tape.
set you up a little bit here. All right. If you'll just spin around for me, sir. There you go. Good. All right, so we're going to run you out, take you out here. We're going to do a few things to you, okay? We're going to put you on the monitor. We're going to start IV on you. Probably put you in some fluids and stuff. Get some blood and everything.
I'm down. Alright, little bumpy coming in.
We're going to do a few things to you. Like I said, he's going to start lying on you. I'm going to start putting you on the monitor, okay?
Okay.
All right, we're going to put you on the heart monitor and stuff, okay? He's going to start lying on you, put the blood pressure cuff on you. We're going to take a set of vitals and everything again,
Okay.
okay?
All right.
We'll put this on your arm. It's going to be tight for just a few minutes, okay?
Oh, okay.
I'm going to unbutton your shirt here, okay?
Okay.
Probably want to untuck it too, okay?
All right.
All right, going to be a big stick over here. 1, 2, 3.
All right, these sleeves may be just a little bit cold initially sticking on you, okay?
Okay.
Be aware of symptoms of a heart attack. The faster you react, the less damage there will be.
Once you get that, will you get 324 aspirin for me, sir?
Yeah, we'll.
Blood pressure's good. All right, I'm going to hook a bunch more of these things up to you here.
Okay.
What kind of medical history do you have again, sir?
Just cholesterol.
Just high cholesterol?
Yes, sir.
324 aspirin.
Yeah, 324 aspirin. Go ahead and get the ball of nitro out also. Is your pain still on a scale of 1 to 10? Still about a 9.5, 10?
Pretty close, yeah.
Okay. You got me a good line over there, sir?
Got your line. You want me to go ahead and draw blood?
Yeah, go ahead and draw me some blood. And go ahead and hook me up a bag of fluids and stuff. We'll go ahead and give this guy some 1 round of nitro there.
There you go. Let me give it to you. All right. Need you to raise your tongue. Put this under your mouth, under your tongue. Let it dissolve. Okay. All right.
All right, sir. Your last name's Thornton, correct?
Yes.
Okay. Thorton?
Thornton.
Wayne's your first name, right, sir?
Yes.
All right. Gonna give you something, maybe relieve some of that pain in just a second. Okay.
Okay.
How old were you again?
66.
You lay real still for me, okay?
Okay.
Blood at 10:43.
All right, just lay real still for me. I'm gonna run a quick test on you, okay?
All right.
All right, you're good, sir.
Okay.
That looks good here. Go ahead and transmit this to the hospital.
The person receives necessary cardiac care before they get to the hospital, allowing hospital staff extra time to expedite transportation to a facility that provides a higher level of cardiac care.
What you got?
Got a 66-year-old male, playing chest pains, been going on approximately 5-10 minutes prior to arrival. He's had 324 aspirin. He's had all nitro times 3 with some relief. Said he's still about a 7 or 8 on pain. Got you a blood draw here also. He's on 3 liters of oxygen, nasal cannula. It's gonna be a little bumpy coming out.
Cardiac.
Emergency dispatch operators are trained in heart attack care and can give instruction to initiate care in the home prior to EMS arrival. By calling 911, care begins at home. Paramedics are trained in ECG interpretation. If the ECG is positive for a specific heart attack, that is called a STEMI. EMS will call for a helicopter to transport that person to the cath lab and will bypass the local hospital. If the ECG does not reveal this specific heart attack, the patient will be brought to the local hospital to initiate protocols and care that can be completed prior to transport that improves the patient's overall outcomes and prevents additional damage.
Dr. Giles, what kind of trouble you having?
Arms hurting, chest pains, shortness of breath.
How long you been hurting?
Oh, seems like 2 forevers right now.
You have any medical problems?
No,
Allergic to anything?
no,
You smoke cigarettes?
no,
Any family history of heart problems?
no.
How's your pain now compared to when it first started?
Maybe 7.5.
How bad was it when it first hit?
It's pretty rough, maybe around 9, 9.5.
All right. Go ahead and get another 12 lead on you.
All right.
Heart attack is the #1 killer in the adult population. There are 800,000 heart attack deaths each year. Risk factor reduction can reduce heart disease. Recognizing symptoms can help minimize the damage and change the outcome. Several hours can make the difference between a pleasurable and enjoyable life versus no life or becoming a cardiac invalid.
Got one more sticker.
Oh, here it is. Did you find it? There's too many extra.
Hold real still for about 10 seconds, sir.
few more seconds.
All right, you can move normally now, Todd. Sir, it looks like you're having a heart attack. We're going to need to get you to a cardiologist. Do you have a preference of a hospital you'd like to go to?
It doesn't matter.
Doesn't matter? All right. And to kind of expedite things, we're going to get you on a helicopter. Is that all right with you?
Okay.
In the meantime, we're going to be giving you some medication to try to prevent this from getting any worse.
Okay.
All right? Go ahead and get the helicopter to Brownsville Hospital Transfer Center. This is Dr. Giles at Lincoln Medical. We've got a stage that needs to be transferred down for PCI. Very good, thank you.
This is Donna from Lincoln Medical Center. I have a STEMI and I need air evac en route.
Calling 911 saves time and saves cardiac muscle. As we watched the scenarios unfold, we saw in the first scene a female patient. The total time from when the patient first felt chest pain at home until she was transferred to a higher level of cardiac care from the hospital was 85 minutes. What we noticed most is that she did not receive any medical care for the first 55 minutes. This takes into consideration that she called soon after her chest pain began. In reality, most people wait much longer before they seek care for fear of being embarrassed if it is not true chest pain. In the second scenario, the patient called 911 soon after the onset of his chest pain and shortness of breath. By activating 911, emergency medical dispatch initiated medical care by telling the patient to take aspirin at home prior to EMS arrival. His actual medical care began when the first responder arrived at his home within 5 minutes. This is a difference in 50 minutes between the patient who did not call 911 and the patient that did. The patient that came by 911 was transferred to a higher level of cardiac care in 69 minutes because medical care started at home, about 10 minutes after his chest pain began. Calling 911 can make a difference. It allows cardiac muscle to be saved, giving a person a higher level of functioning after a cardiac event, or it can save your life. Recognize that time is saved by calling 911 and care begins at home. Saving time saves cardiac muscle. Be alert, be active, be heart smart, and remember, heart attacks do have beginnings.
Well, that was a pretty incredible video, a complete reenactment of all the process of if you have chest pains and the proper way of dialing 911 and getting the ambulance service to you, because when you get the ambulance service there, it's almost like ER on the scene a lot quicker than you would be if you phone a friend.
Absolutely, and we hope that this helped individuals at home watching. Maybe you've experienced a heart attack before. Maybe you've had chest pains and you've put it off and said, no, it's okay, I'm going to get it checked out later. We hope that this video has shown you that the proper thing to do is call 911 to get up here. We would much rather send you home because it's nothing than for there be a more serious problem and for you to be harmed in any way. So. I hope you've seen by the video that we have some fantastic people in this community working to take care of you, to take care of the patients, and I think we do a great job up here, Don.
You have a great hospital, a great ambulance service, we have a great 911, and we have a great community, and we want to teach the community and teach the public in general how important it is to dial 911 and get emergency medical services people to you as soon as possible, because not only do you have the ambulance service out in the community, you have first responders who are there to give you oxygen and sort of assess the situation to take care of you, and then also air evac. That whole system is just an amazing system.
Absolutely, it is. And very interesting that we've done both of these scenarios. They were done in the county, so it's a little different than if it's in the city. Of course, we had a first responder who came out and assessed until EMS arrived on the scene. If that happened in the city, we might have the Fayetteville Fire Department to help us out. So it takes lots of people to make it possible, but there are lots of individuals who are caring for people in this community, and I think they do a great job.
I'd like to thank all the people who helped us make this video possible. Mary Beth. I know
Absolutely. Listen, I want to thank you, Don, Fayetteville Public Utilities. This was a great thing. I know Channel 6, I know you guys will be showing this on Channel 6, and I hope people enjoy it. And thanks again to the staff at the Communication Center up at E911 and our first responders and our...
Deborah Yarbrough, we want to mention her.
Yes, Debbie
want to mention
Yarbrough in the
Richard
ER.
Wright.
Richard
Wright
Wright
started out on this video early on, helping us.
He sure did.
And then who's the...
Chad Brown, Shanna Rodriguez in the ER. It took lots of people. Amy Fitch was over at the 911 Center doing the planning behind the scenes for us.
Dr. Giles.
Dr. Giles, yes. He's head right now of our ER, taking care of things there, and he does an excellent job. And this is actual protocol. I want to make sure that everybody understands what you see is exactly what would happen to you if you came in, even down to the ladies or the gentlemen that sit at the front desk. When you come into the emergency room, they are trained to know those signs, those symptoms. If you say you're having chest pains, I mean, you're going back, and we're starting on you, and we're getting you out to where you need to be.
That's what it's all about. A lot of people behind the scenes who we had numerous meetings to plan this out to get it to be down to the way that it's supposed to be done.
That's right. That's right. We want people to see that. We want you to know things as simple as when you call 911, what that looks like, where that call's coming in at. We wanted you to see the guys, you know, that when they may be working on the computer or they may be having some quiet time watching TV or on the phone talking to their family. We wanted you to know what that sound was, what it's like for them, what they hear, how we get them to you. I mean, I think this is great, and I hope that a lot of people watching the video think to themselves, you know, I didn't know this before, and we hope it eases some people and they feel a little bit better about it.
Thank you very much for watching here on Fayetteville Public Utilities Channel 6. I'm Don Counts, and we'll see you back in here next time.